People talk about the cracks in the system. I call the cracks in the system the gaps in the system, or the gaps in patient care. So part of this is just related to, I think, fragmented care that occurs when there's multiple physicians, but nobody's really taking the lead. There's too many referrals out to other physicians, but the care is not necessarily coordinated. And then you get into other aspects of medicine where, people talk about Eastern medicine or Western medicine, or they talk about traditional medicine or what's now termed functional medicine. And I think a lot of what happens is you don't get that coordination of care, and that causes gaps in the care. And unfortunately, it's those gaps that the patients are really suffering with. Patient can have diabetes and high blood pressure and high cholesterol. Physician can prescribe medications for all of those things. And whereas on paper, everything may look good, blood pressure's normal, blood sugars are within normal range, blood pressures look good, but the patient may not feel well, and the patient may not feel well because they're tired, or they're not sleeping well, they're gaining weight, they just overall don't feel well. And a lot of times those questions and those problems are not answered, and that creates the gap in care that the patient's really concerned about. Because when they go home, they're not thinking about their blood pressure, and they're not thinking about what their blood sugar was, or what their hemoglobin A1C was, or what their cholesterol looked like. Or they're thinking about how they feel, how they feel when they wake up in the morning. Did they get a good night's sleep? How they feel, do they have energy? What their body looks like. Do they gain weight? Are they having hair loss? Things of that nature. And these are all the things that patients are concerned about, just as much as, their blood pressure and diabetes and so forth. They just don't think about a lot of these things that the physicians are taking care of on paper. They think more about the things that affect them on a daily basis that they can see and feel. So that's really one of the things I like to focus on, is closing those gaps in care and making sure the patient has all of their issues addressed.